Hi, this video is for my patients who I have prescribed an SI belt for and to explain the sprained SI. So our pelvic bowl is made out of 2 ilioflat bones and 1 sacral bone, hence the name Sacroiliac SI joint. And we can see that it wiggles. Now technically this is considered an immovable joint because there's no muscle designed to move it. Unlike, for example, the hip joint, you have muscles that make that joint move. So when you sprain an SI joint, the problem with it being an immovable joint, again, there's no muscle designed to move it, so there's no muscle specifically good for stabilizing it. So instead, a bunch of other muscles get involved. You have your hip flexor that tightens, which, yes, it crosses the SI joint in the front, but it also attaches to your leg bone, and so that it also puts pressure on your hip. You have muscles in the back, the piriformis muscle, it also attaches to the hip. The TFL might try to get involved to stabilize the area. Your low back muscles might tighten to help stabilize the sacrum. So basically a bunch of muscles get involved trying to stabilize this loose joint. And if you do any movement that reopens up and resprains that joint, then it's not going to heal. It just keeps re-tearing with every movement. And that's why I prescribe an SI belt. Now, typically I don't like bracing because I want your own muscles to get strong and stabilize you. But again, there's no muscle designed to do that. So if you use an SI belt, you're not gonna be at risk of weakening your muscles because no muscles do this action. And notice when you squeeze the flat bones together, the tailbone doesn't wiggle as much. If I don't squeeze it, it's very loose. So let's go on to how to put on the SI belt. So this is what the SI belt looks like. And as you can see, it has material here that's kind of sticky. You do not want this against your skin because it can irritate your skin. What I personally did when I sprained my SI joint is I would use a tank top, put the SI belt over the tank top, and then put on my underwear so that I didn't have to mess with that SI belt every time I went to the bathroom. So to put it on, you put it around you. So again, the sticky stuff is towards you. You want to make sure that it is above where your hips bend, but below where your flat bones are. And you can put your hands, what people call the hip, even though your hips are down here, that hard bone you can feel, make sure the belt is below that. And again, not in the way of your walking motions. You put the material underneath the white bar, and then you put it over the white bar. The bar has basically teeth on it that helps hold it in place. I like starting it with the leather off to the side so that when you tighten it, it goes more to the center. Give it a really hard squeeze, give it all you have, and then you can use the Velcro to put it into place. And again, you could do this under your clothing. And it doesn't interrupt my walking, so it's not gonna affect my hip flexors, and it feels good to squish those bones together. So when do we use the SI belt? The SI belt is used again for people who have a sprained SI joint. And how does that happen? The most common times I see people needing an SI belt is after delivering a baby, because that involves a really big opening of the pelvis, and that can sprain the SI joint. Another time is after a car accident. If you're hitting the brake really hard during impact, that force can transfer through the leg and sprain the SI joint. Or some other trauma. Again, when you have back pain, or especially pain right here, this is where your SI joints are. If you can point to it, sometimes that's a sign of an SI sprain. But it can also be a sign of other back conditions. So make sure you get a proper diagnosis. If you have back pain that radiates into the buttock, it could be your back, it could be your hip, it could be your SI joint. So make sure that if your treatments aren't working, or if they're treating for low back pain or they're treating for hip pain and you're still having pain right there, get your SI joint evaluated. Maybe instead of being mobilized, maybe instead of being strengthened, the ligament needs to be held together. It takes 2 months of wearing the SI belt to allow the body enough time to lay down the fibers to stabilize that joint. And remember, you have 2 SI joints, so as you stabilize one, you have to have follow-ups to make sure that the regular side doesn't get too tight. And that's where chiropractic care is really critical, is making sure that you keep the good side well. And after wearing the SI belt for a couple months, then you just wear it during activities that might sprain the SI joint. for a month or two, depending on what your healthcare provider prescribes. I hope this has been helpful to you. And again, this is specifically for my patients that I have prescribed the SI belt, but hopefully it's helped other people who have back pain who are not responding to normal care. Until next time, stay well.